I hope I don't have COVID. I don't want to have COVID, but my throat hurts.
Hi, Kathy, Dr. Merrill. May I book a patient for tomorrow for the Remdesivir for 3 days, please?
Hey guys, welcome back. So, despite all my precautions, I got COVID. Although it seems like everybody's getting COVID nowadays. If you're new to my channel, my name is Wendy, and about 5 months ago, I had a kidney transplant. And as a transplant patient, I get treated with very strong medications that lower my immune system. So, as you can imagine, the last thing I want to do is to get COVID. But that already happened. Today in this video, I want to share with you guys what that experience was like. Everything from my symptoms, my experience with the infusion, and also I want to show you guys or tell you guys about my lab results. I had labs done before I even started with having symptoms. I had labs during my infusion, and obviously while I was having symptoms. Then I got labs done right after I was pretty much cleared out. And I just want to show you what was my kidney function and my liver function during those times. But with that being said, I started having some very mild symptoms for a couple days. I had a little bit of sore throat. But on the third day, I was informed that a couple of my co-workers tested positive for COVID. So I went and got tested, but because of the high demand, my results were gonna take 4 days. And during those 4 days that I was waiting, my symptoms actually increased a little bit. I felt like just a general feeling of being sick. Not enough to send me to bed. I did my routine, my daily routine, just as always. I exercised, I cooked, I did my days as normal. I did not experience any fever or headaches or body aches or anything like that. It was pretty much the sore throat, coughing from time to time. After 4 days of waiting for my results, they came back and they came out positive. My doctor actually called after my results came back and said that I needed to get the infusion. Although I wasn't having bad symptoms, he said that it was better to get the infusion because what happened is that because of having the immune system so low, the symptoms, although they're not drastic, they linger and then can eventually turn into more drastic symptoms, and then it will be harder for the body to fight them. So this is my experience with the infusion. The infusion is administered via IV. They put a port in my hand that I have for the 3 days just for easy access, I guess. But pretty much what the infusion does is to stop the virus from producing a specific enzyme that is necessary for the virus to reproduce. So when that happens, the virus can no longer multiply in the body. There's different kinds of infusions out there. I got the Remdesivir infusion. Those infusions right now are not available for the general population. It's pretty much for people that are at a higher risk. So the first day I got 2 doses at the same time, and then a single dose the next day, and then a single dose the following day. I went to the place for my first dose, and the first thing they did is to take a blood sample and put a port in my hand. The blood sample is to kind of like to have a baseline and see where you at with your kidney functioning, your liver functioning, because the infusion has the potential to affect the liver. They take a blood sample the first day before you get the infusion, and then they take another blood sample before the second infusion the following day. If the infusion is causing any damage to the liver, they pretty much stop it. I sat down for about an hour to get the infusion, and then they asked me to stay for another 30 minutes for observation. They just wanted to know if I had a reaction to the infusion. I left there and I felt pretty good. I felt fine. Like nothing happened, and it was like that pretty much for the rest of the day. Thing that happened at night is that I got a massive headache. I think it was a side effect of the infusion because my COVID symptoms were very mild, you know, to have this massive headache, but it technically could be both. So during this couple days that I was getting the infusion, I noticed something at that place. Everybody that was in there was really sick. I was actually doubting if I had COVID. So before I left for my third dose, I took a rapid test and it turned out to be positive. So I went and got my last dose of the infusion. I mean, I was still gonna go and get it, but I had that doubt, you know, and it turned out I was positive. So at this point, I was, I guess, thankful that I had COVID and I wasn't having these crazy symptoms like other people. But anyways, a couple days of getting the infusion, I feel like my symptoms just pretty much vanished. Just a little bit of symptoms that I had went away. I went back to work and I was feeling just as normal. And like I said, I had labs done before, just for a regular checkup. It was right before I started feeling the symptoms, and my liver function and my kidney function were pretty good. So the first day that I got the first dose, they took a blood sample and they also checked for kidney function and liver function, and everything was fine. Everything was, my creatinine was still at 0.8 and my liver function was everything within range. I got labs done on the second day of my infusion just to see if the infusion was causing any irritation to my liver. From that point, I got another set of labs. So I finished with the infusion on Friday. I got the labs done on Tuesday, and at that point I was completely asymptomatic and my liver function was fine. Everything was in range. My kidney function was also in range, but there is a test that they do. It's called aspartate something. I'm gonna put it here on the screen, and that was high. My doctors say that is in fact a sign that there is an irritation to the liver. Because of my liver panel was in range, everything was fine. My doctors say that there was really nothing to worry about, that was most likely because of the infusion, but it should be temporary. It should go back to normal once the infusion is kind of out of my system. But anyways, guys, today is about 16 days since my symptoms first appeared when I had COVID and I had the infusion. Today I feel just fine. I don't have any symptoms. I feel pretty good. And something that did come out during all this labs that I got done is that, and this has nothing to do with COVID, but my A1C is like 6.3 or something like that, which is in the pre-diabetic range. That is sad to hear because I exercise and I try to do my best to keep that in range, but I do accept prednisone is causing me to be very hungry. So I'm eating a lot and I feel like that's what's causing that. I know I need to do something about it, but anyways, that's a whole nother subject. So just as a side note, guys, I have the 2 vaccines. I took the Moderna vaccine back when I was on dialysis. I don't know if that's why COVID didn't affect me as much, at least for those first 6 days before I got the infusion. I don't know, but either way, I feel very lucky that things were like that. I hope things are like that for you if you end up getting COVID. Like I say, it seems like everybody's getting it now. I feel like, whew, this one is done, you know, and over. I'm sure there's going to be another variant that's going to come along and it's going to have different characteristics. Something is very clear to me. Regardless of how careful I am, I'm going to catch things. And it could be COVID, it could be something else. All my family here in the house didn't get sick at all. They got tested twice. They came out negative. I was the only one that tested positive twice. It just means that either COVID or something else, I'm most likely to get it. So that kind of scared me a little bit, but at the same time, I mean, we can't cage ourselves, you know. We have to live this life, and we had a kidney for a reason, you know, to continue living, to continue enjoying life and enjoying things in life. I have to get out there, I have to do things. Anyways, guys, that was my experience with COVID and also with the infusion. I hope you have even a better experience. You know, continue to take care of yourselves and stay strong, stay healthy, and I'll see you guys in my next video.